Hello everybody, my name is Emily. I'm a content creator from Singapore, and today I will be coming clean with an issue that I have struggled in the past for a very long time, and that is dandruff. Oh my gosh. Okay, today I will be inviting a special guest with me, so please stay tuned as we are going to be discussing about fungal issues such as dandruff. Do you know that dandruff is actually very common and it affects approximately 1 in every 2 people? There's still this stigma around it, and some have the misconception that it's due to poor hygiene. Okay, to be honest, it took me a very long time and a lot of courage to tell my family and friends because I was very embarrassed about it. But I realized that I'm not alone in this journey, and you are not alone too, which is why I'm filming this video to come clean and encourage all dandruff sufferers like myself to strip the dandruff labels, the dandruff stigma, together with me. I've been struggling with dandruff for a decade since I was in secondary school, and I've tried so many shampoo brands and even multiple home remedies such as apple cider vinegar, but none of it worked until I went online and I saw a recommendation for a 2% ketoconazole shampoo which had so many positive reviews. I tried it and it cleared my dandruff in 2 to 4 weeks. For today's episode, I'd like to welcome a special guest, Dr. Davin, who will be sharing his expertise and insight about fungal issues. So everybody say hi. Hi, Dr. Davin. Nice to meet you.
Hi everyone, I'm Dr. Davin Lim, a board-certified dermatologist based in Brisbane, Australia. So Emily, you would like to know more about scalp fungal conditions.
I was a chronic dandruff sufferer with white flakes just falling out from the top and the side of my head. And I heard that the root cause of dandruff is actually fungus. Is that true? Can you tell me more about dandruff?
You're right, the 2 biggest myths about dandruff include firstly, that it is contagious, and secondly, it's due to poor hygiene. Some people are sensitive to a yeast called Malassezia furfur. This yeast naturally exists on the scalp. However, for some people, this type of fungus is harmless and part of the scalp and skin. However, in others, it's allowed to overgrow, and this yeast can cause inflammation. And this leads up to the buildup of skin cells which then flake off. So there seems to be a genetic predisposition to flaking, as dandruff can run in families. One should be mindful of other conditions like eczema, fungus and psoriasis that can lead to scalp flaking, in turn mimicking dandruff. So does the environment one live make a difference? That is the question. Overgrowth of Malassezia can occur because of less UVA. This wavelength of light regulates the yeast production. Some dermatologists recommend getting a sensible amount of sunlight in moderation. Additionally, in the winter months with less humidity, this can lead to drying of the skin and scalp, leading to more flaking.
That's so interesting. I didn't know that these factors play a role in causing scalp fungal issues. I've heard about seborrheic dermatitis. What is it and how is it related to dandruff?
A simple way to understand is that seborrheic dermatitis is dandruff of the skin, and conversely, dandruff is seborrheic dermatitis of the scalp. Some patients have one or the other, but it's not infrequent that they may suffer from both these conditions.
Oh, I see.
The cause of seborrheic dermatitis is the same as dandruff, namely Malassezia yeast. The yeast populates the skin cells, leading to flaking. Clinically, seborrheic dermatitis presents as red scaly rashes on the folds of the nose, eyebrows and scalp margin. It can be stingy or even itchy. Most patients don't need to see a dermatologist, as there are effective over-the-counter creams that contain an antifungal as well as an anti-inflammatory. This applies to both dermatitis and dandruff.
For sufferers like myself, what are some common treatment options which you'll recommend for us to maintain and control our dandruff?
There could be various treatments depending on the condition. My go-to is a medicated shampoo. I normally prescribe this to patients, and it's called ketoconazole. So for milder cases, I also prescribe selenium sulfide or zinc pyrithione. For extreme cases, especially if there's marked itching, I also prescribe a short course of anti-inflammatory lotion. Occasionally, I go to the old-fashioned coal tar, salicylic acid and sulfur. It's really important that patients leave in the shampoo of choice for at least 3 to 5 minutes, as dandruff affects the scalp and not actually the hair. In the acute phase, there may be symptoms such as itch. However, it's super important not to irritate scalp skin with too much hair product. Oh, the other thing as well is to keep blow drying to a minimum. It will dry out your hair, and use a cool setting on the hair dryer.
Yes, earlier you mentioned ingredients such as selenium sulfide, zinc pyrithione and ketoconazole. What exactly is this ingredient? What are the difference between selenium sulfide, zinc pyrithione and 2% ketoconazole shampoo.
Pyrithione zinc, also commonly known as zinc pyrithione, has an antibacterial, antimicrobial, and also antifungal properties, and that can help with dandruff. It's great for milder forms of dandruff. Selenium sulfide, on the other hand, is another topical antifungal treatment, and it does slow the growth of yeast on the scalp and body. So selenium sulfide is known to be a little bit more irritating in comparison to zinc and ketoconazole. Unlike other topicals, selenium may cause some transient stinging on inflamed scalp. Additionally, people complain that it may stink a little bit, and that's due to the sulfur component. So ketoconazole is the compound of choice for many dermatologists. This proven anti-dandruff shampoo targets the culprit of dandruff, namely the Malassezia yeast. So by reducing the number of yeast organisms, it can help control flaking of the scalp, in addition to symptoms such as itch and irritation. It doesn't have the medicinal smell of selenium, yet it is one of the strongest anti-dandruff shampoos that you can buy over the counter. It was originally a prescription of 2% ketoconazole, but now you can buy it without a prescription in most countries. For dandruff, the treatment is twice a week for 2 to 4 weeks. You can then prevent relapses with an application once a week or once every 2 weeks. So remember, the yeast affects the scalp, not the hair itself. So it's super important you let it soak on the scalp for at least 3 to 5 minutes before rinsing off.
I'm so glad to gain more insights and clarity on this topic. There's still quite a bit of stigma and misconceptions surrounding it, but it's good to know that with the right ingredients, dandruff can be treated effectively. Okay, doctor, while I have you here, I've previously posted on my IG stories to collect some burning questions which my followers have asked about dandruff and seborrheic dermatitis. Shall we dive right into it?
Let's go.
The first question and the most commonly asked question would be, is dandruff contagious?
Well, no, dandruff is not contagious. Even though it's thought to be a yeast infection, the yeast stays on the scalp of the patient and cannot hop onto another person's scalp. So you can't give dandruff to anyone, nor can you catch it from flakes from friends or even loved ones.
Oh, I was actually under the impression that it is contagious because since young I was advised not to share comb and towels, but I guess it's just part of personal hygiene. It's so good to have this misconception all cleared up. The next question, which is pretty important as well, would be how effective are over-the-counter treatments and why does some anti-dandruff shampoo just don't work for me?
Over-the-counter treatments can be very effective in treating dandruff. However, it may not work for some. You see, flaking of the scalp can occur with other conditions apart from dandruff. So flaking can be due to dermatitis, eczema, or even psoriasis. And that's why it's super important to receive a diagnosis if anti-dandruff shampoos don't work. The flip side, however, is that there are more cases of dandruff, especially if it's associated with scalp inflammation. For severe cases, a dermatologist can prescribe a short course of anti-inflammatories to be used in conjunction with your shampoo.
Oh, I see. Down to question 3, and which is also a burning question asked by my followers. What can worsen dandruff?
There are many flare factors for dandruff. For example, we mentioned environmental causes. I mentioned low humidity in winter, as well as reduced amounts of UVA light. This makes almost all skin conditions worse, and dandruff is no exception. Too much hair products as well can dry out your skin and further aggravate inflammation, leading to worsening of dandruff. Hormonal changes also play a role. Increased oil production during puberty can flare up dandruff. Other conditions that can flare up dandruff include dermatitis or eczema.
Interesting. Lastly, Dr. Davin, does genetics, lifestyle, stress, or diet play a part? If yes, can you please elaborate more so we can find out why?
One of the most important factors that can flare up dandruff is genetics, as dandruff can run in families. As for diet, it's super controversial. There are studies out there that show a diet high in sugar, dairy, processed food can lead to spikes of insulin, which in turn can stimulate hormones, which can trigger the output of oil or sebum. It's much like acne. So overall, restriction of fatty foods, fried foods, refined sugars, processed foods, and gluten may reduce your rate of flaking. Biotin is another vitamin that can help maintain the health of your skin and scalp.
Well, that sums it up. Thank you so much, Dr. Davin, for joining me today and giving me a crash course on dandruff and how we can all get it under control. Now we have a better idea of what to do when we are struggling with dandruff.
No worries, I hope this was educational to all of you out there. Dandruff is not difficult to control. You just have to use the right products and stay away from factors which could worsen your dandruff.
That's right. Thank you all so much for watching it till the end. Please help to share this video with your friend, family, or anybody that you know that's suffering from dandruff so we can all tackle this dandruff issue together. Bye!
Bye for now.